Good morning, all. Thank you for joining us today. My name is Dr. Kevin Steele, and I'll be your host for today's webinar entitled Your Lifespan versus Your Disease Span. Where do you fall? I am going to introduce our presenter, Dr. Jim Herkimer. Dr. Herkimer has been involved in health, fitness, and rehabilitation for over 35 years. He's the CEO and Executive Director at Sports Conditioning and Rehabilitation, or SCAR, in Orange County, California. He has extensive experience working with all levels of athletes, including those from Major League Baseball, the NBA, NFL, NHL, as well as multiple Olympians. He is a well-known author and speaker who has appeared on Healthy Matters, ESPN, and numerous local news shows. Dr. Herkimer has also worked closely with several nonprofit groups, including the California Governor's Council on Physical Fitness and Sports. So Jim, thanks in advance for sharing your knowledge and expertise with us today, which I know will have a great positive impact on today's attendees. So with that, please take it away, and I'll be back later in the presentation.
Kevin, thank you so much. It's such an honor to have the opportunity to spend some time with you and everybody that has been part of this incredible organization with MedFit. I've had the opportunity to be involved for some time now, and it's one of the best organizations that I have ever had the opportunity to be involved with. So I'm pretty excited about what we have to do here today, and I wish I had a nickel for every time I've heard this statement, you know, the quote unquote, since I turned 50, things have just started falling apart. And you know, the interesting thing is the more and the longer that I've been doing this, I'm hearing this more often than ever before. And I really think it has a lot to do with just the types of activities and behaviors and situations that people are getting themselves into. And what I start to see is because of this type of activity and these types of statements and the types of patients that we're seeing more and more of, it really led me to take a closer look at what's happening to people as they age. But let me emphasize first that I'm a clinician. So I look at basic research and I look at clinical research and I try to apply it to what I do in my practice. And the one thing that is for sure is we don't all fit one paradigm. So as we go through this presentation today, I want you all to keep in mind that some things will make sense to you and your clients, and some things may not. And that's okay, but the principles are all well grounded. So let's kind of jump in and take a look. So my question is, what is your health span? And as well as, you know, what's your disease span? So I really look at the health span is how long through your lifespan are you maintaining a high level of function and productivity, and at what point, at what age do you start to see a decline in your function and a decline, and are you well into your 80s and 90s, or do you start to see a decline early on at 50 or 55 or 45 in some cases? So I want to tell you a little bit about a couple of clients of mine. Sam is a 90-year-old retired chemist. When he's not under the stay-at-home orders, he usually comes into the clinic 5 times a week, rides the bike for 15 minutes, jumps on the elliptical for 15 minutes, moves over to the treadmill, goes about 30 minutes on the treadmill, hops off, knocks out 10 unassisted pull-ups at 90. I wish I could do 1 unassisted pull-up today. Follows that up with his strength program and his balance program. He's, you know, so he is spending time with his family, his friends. He feels great. He feels energetic, and this is going on. He's got high level of function, lots of productivity, well into his later years. Now, Sam really is that blue line guy, right? He's our elongated health span guy. On the other hand, I have Bob, who came in and saw me a few months ago, and these are two actual people. These are not people I'm making up here. Bob is 62. He sleeps on the recliner most nights because his back pain is so severe that he can't stay in bed. He's an attorney working long hours, has high levels of stress. He has poor exercise habits. He has, limited ability to eat well. He's borderline diabetic, and he recently started blood pressure medication for his newly diagnosed hypertension. So we can really think of Bob as the orange line guy, really early onset disease span. I'm going to come back to, or we're going to come back and visit Bob later. But for now, I want to really set the stage. So who is it, or what are we calling this sort of disease span, lifespan, health span group? And there's lots of things that people can identify with, integrative medicine, complementary medicine, functional medicine, anti-aging medicine, age management, longevity medicine. All of these things are part of the group. And we've got physicians and DOs and chiropractors and nurse practitioners and physical therapists, nutritionists, acupuncturists, dietitians, all contributing to this piece. And I want to jump on my soapbox here for a second. And I think the missing group on this list, and I left this off the list on purpose, is I think it's really important for us to include the medical fitness professionals, because I can't think of anybody who is more front line in working with people to maximize their clients' health than those people. So let's really look at how can we as medical fitness professionals drive home the ideas that we're going to talk about today. So now let's get down to some basics, and when I say basics, I mean really small. Remember, our DNA is our hereditary material that's found in all of our cells. It's really the blueprint that drives function. It drives our cellular reproduction. Now, remember, early on, genetics, many of us believed that your genes were your destiny. So if your parents lacked health and vitality and suffered from chronic disease, then you were probably going to suffer the same fate. But as we started to recognize that the quality of our health is shaped by more than just this predetermined or this preset of blueprints, and now we know that we have chemical compounds that we can add or that are added to genes that will regulate their activity. That's our epigenetic theory, right? I think George Bray, who's an obesity researcher, said it, and I'm going to paraphrase. This is not exactly what he said, but this is sort of how I like to say it, is it might be more appropriate to say that your genetic makeup loads the gun, but what your lifestyle choices are is what pulls the trigger. So we can dive a little deeper into the DNA tips on the ends of your chromosomes, and Liz Blackburn, who is the person on telomere function, is I think is one of the founding principles in this whole idea of maintaining healthy cells. Is each time our cells divide, the telomere shorten, so which really determines how fast your cells age, and at what point they die. So if it's possible to slow down the rate of telomere shortening, then in some cases we may actually slow down aging, or in some cases reverse it. So telomeres really respond to what you tell them. They absorb absorb your instructions. They are dictated by nutrition, emotions, your exercise, your stress. These are just to name a few things that will influence how your telomeres are impacted. So it's possible then that we can impact our telomere length. And by maximizing the enzyme telomerase, we can really restore the DNA that's lost during cell division. So if we can figure out how to increase the telomerase, we can have a very positive impact on your disease span. And when I look at, and Dr. Blackburn explains this wonderfully, but when we look at telomeres and use the analogy of your shoelaces, the telomere is like the aglet, the end of your shoelace that's encapsulated in that plastic, so it makes it really easy to put the shoelace through your shoes. As your shoelace gets old, right, that aglet starts to fray, and as that aglet frays, it starts to get harder and harder for the shoelace to function correctly. So the telomerase helps to maintain the quality of the aglet on your shoelace. But ultimately, all good things do come to an end, and eventually cells they lose the ability to divide, and they become senescent cells. And senescent cells are sometimes referred to as zombie cells. They're just kind of zombie-like. They're floating around. They're really not helping. They're really not doing their job well, and they tend to leak pro-inflammatory substances. So, you know, a higher number of senescent cells is really an indication of this onset of our disease span. So really what we want to look at is balance. And this really issue of balance is that our systems are dynamic and ever changing. So we have cells that are providing building blocks for tissue, which are blastic cells. And we have cells responsible for tissue degradation, which are really our clastic cells. So as long as the cell activity is balanced, we see normal tissue adaptation. But what happens when we see greater clastic activity? We tend to see greater inflammation, we see more dead debris, and we have to figure out how to get that dead debris out of the area. So our lymph system is responsible for moving that cellular waste for filtration and elimination. And it works by pressure changes, which are associated with muscle contractions and a series of one-way valves to aid or to limit the amount of pooling of the lymph. But in situations of elevated cellular debris, we get changes in that osmotic pressure, and we get kind of a fluid buildup. So with that elevated level of stasis, that fluid buildup, we lose the ability to get good oxygen exchange and nutrient exchange. And so we end up again with this elevated level of inflammation. And lastly, the balance of, and I'm just going to spend a quick hot second on this because this hormone balance between the axis, this could be a week long chat about the interrelatedness of the hormone balance. So oftentimes we look at each organ in isolation. We look at the hypothalamus, the pituitary, the adrenal glands, the thyroid, the ovaries and testes. We look at those in isolation and the hormones that they secrete. But I think it is vitally important that we remember the interrelatedness of the endocrine system. You know, low testosterone does not automatically mean testosterone supplements. We need to look at the bigger picture. I can't stress that enough. We've got to look at the bigger picture. And so our balance then really becomes dependent on what compounds and what chemicals may be triggering changes in DNA expression. So people who are involved or are in certain environmental conditions, elevated levels of smog or ozone. A number of people will consider the effect that global warming has on our environment, and that environmental stress has on our on our bodies. Psychological stress occurs in all of us all day long, and your body will respond not just from the stress, but really based on how you interpret and manage it. So stress management becomes a vitally important component to looking at what point do I start to see that shift in the disease span. Food, boy, we could go on and on about this one. The standard American diet, processed food and the impact that it has on your microbiome, its impact on that food sensitivities have on our immune system. Things, gluten. I've read some data that suggests up to 90% of the population has some level of gluten insensitivity in the US. We know what impact sugar has. I always like to say sugar, I tell my clients all the time, eating sugar is sort of like adding kerosene to a fire. So unless you're okay with your house burning down, you really need to pay attention to sugar and hidden sugar and added sugar. Chemicals. So how many of us grew up at a time when there was lead paint in the walls and asbestos in the ceilings, and we've used glyphosate to kill the weeds and genetically modify crops. So a chemical influence has a tremendous impact on the balance of our immune system. We're going to come back to inflammation and spend some time looking at inflammation. And then that last one, oxidative glycation. What are the things that you're doing that is essentially short-circuiting your normal cell metabolism and function? So balance is really dependent on all of these multiple interrelated factors. So let's talk a little bit about chronic inflammation. And this one piece is probably, in my opinion, the leading cause of an early onset disease span. It's associated with so many different things. So let's just look at diabetes, for example. And I really want to expand the diabetes piece to really metabolic syndrome. And when I look at metabolic syndrome, I can look at increased insulin resistance. Within increased insulin resistance, I have glucose intolerance, I have hyperinsulinemia, I have elevated levels of triglycerides, I have decreased levels of HDL cholesterol, I have increased hypertension, and those should all sound pretty familiar prerequisites to cardiovascular disease. Now, it's not just limited to cardiovascular disease. I've had people that have had years of joint disease and arthritis, and when we start looking at the other inflammatory markers, that is not just a local problem, it's a systemic problem. I've had people that have come in who are on chronically taking Flonase and allergy medication, and changes in their diet allow them to decrease the intake of medication. Chronic obstructive pulmonary disease, we have inflammation in the alveoli that result in decreased lung function. So inflammation is an underlying cause of so many of the systemic problems that we're seeing that drive our disease span to an earlier onset. So let's take a little look at how some of that might happen. And this is one of my favorite slides because I'm sort of a geek. But when we look at the epithelial lining in the gut, if I don't have a healthy gut and I have increases in the spaces between those epithelial cells, I introduce the opportunity for foreign substances to migrate across the membrane. And when they migrate across the membrane, your immune system recognizes that as a foreign object and sends inflammatory cytokines, growth factor, and enzymes to combat that foreign body. And that will then create a progression into the tissue damage. I heard the story, and I would love to be able to give the credit to who I heard it from, but for the life of me, I can't remember. But I'm going to tell the story anyway, and it's really an analogy, and that analogy is, and I tell my patients this, and they tend to understand it. Is imagine that you've eaten something, and we're gonna say that whatever you've eaten, the analogy is that it's a string of pearls. So as you eat the string of pearls, and the pearls end up in your stomach, the acid in your stomach unlocks the pearl necklace. So now you have this nice open pearl necklace that's making its way down into the small intestine. And the bacteria and the enzymes in your small intestine take one pearl off, and they move that across the epithelial lining, and your immune system recognizes that and says, "Oh, that's a pearl. I get it. I'm going to send that pearl off to where it needs to go." But imagine for a second if you ate the pearl necklace, unclasped it in your stomach, but got it into your small intestine, and the bacteria, maybe the bad bacteria, chopped off two pearls instead of one pearl. And so two pearls were able to move across the epithelial lining. And now your immune system says, I sort of recognize that, but I'm not sure exactly what it is. So I'm going to send some inflammatory cells. I'm going to put up the red lights here, and we're going to send some inflammatory cells. So now anytime your immune system sees something that is close to your pearls, it's going to send off that inflammatory response. And that's where we start to see autoimmune dysfunction, and we start to see multiple system failures as a result of these, this leaky gut and sensitivities to food. So that's sort of our inflammatory piece of this, and I want to kind of go on to the next phase here of laying down some groundwork, and that's really the role of sleep. And again, we can do an entire webinar on sleep. Earlier we spoke about the lymph system, and now I want to talk a little bit about the GLIMP system. And this is according to Matthew Walker, who's one of the leading sleep experts out of the University of California. And just the same way that the lymphatic system cleans tissues in your body, the glymphatic system, which comes from the glial cells, collects and removes contaminants from your brain. And the cleaning is accelerated when you're sleeping. You could almost think of it like a power cleanse. And the amyloid proteins that are associated with Alzheimer's disease, for example, are really cleaned out during this process. So if you're not getting enough sleep, you're not getting enough cleaning. He uses a great analogy of imagine when the city, when everyone leaves the city, goes home, and the city workers come out to start to clean. If all the buildings could shrink down and they had a power wash to clean the whole city, and it took them about 8 hours to clean the whole city, once they were done, the buildings grew back to their normal size. We'd have a nice clean city. But what if the workers only had 4 hours to clean? There would be a lot of trash left over, and over time that trash would start to build up and start to build up. And so, what's kind of that what's kind of that amount of time that we need, really 8 hours. And we look at these repeating cycles of REM and non-REM sleep, deep sleep, which typically are about 90 minutes each. So the problem with just getting bits and pieces of sleep throughout the night is those cycles progress early on, having a high amount of non-REM sleep, to latter parts, early morning, where we have more REM dominant sleep. So disrupting that pattern also disrupts the process for our recovery. It looks like I've got a little slide mishap. At least this is what it's looking like here, but we'll go with it here. So what do these problems start looking like? And we can see that elevated BMI and elevated glucose levels and poor lipid profiles, elevated blood pressures, all start to look like risk factors associated with other diseases, cardiovascular disease, for example. And where we are in today's world, let's look at who are the people that are at risk for complications associated with COVID-19. The same types of people who are at risk for an early disease onset. So by starting to address these lifestyle problems, we should have a much better opportunity to deal with this pandemic that we're currently experiencing. I'm going to just adjust this real quick. So when we look at the resulting systemic changes, so now we've identified what some of our problems look like with elevated BMI. What's causing those types of things? So now we're starting to look at oxidative stress, where free radicals are attacking a cell and limiting the cell's function. Insulin dysfunction. So we start to eliminate or decrease the insulin's ability to aid in glucose assimilation, which then can result in vascular dysfunction, autonomic dysfunction, and then systemic inflammation. So this is oftentimes where we start to see, our allopathic physicians say, okay, well then, let's start looking at metformin. Let's look at blood pressure medications. Let's look at statins for elevated levels of lipids. And what I would like to suggest that we look at is, let's look at things further upstream. So instead of looking at and trying to address the symptoms that are occurring, let's look above the waterfall. Let's look up the stream and let's look at the genetic component. Let's look at our environment and let's look at our lifestyle choices. And let's see if there isn't something that we can't do before we see these downstream events occur. So let's look at the symptoms, but not treat the symptom. Let's look at the symptom and say, what's causing the symptom? Let's go further upstream. Let's figure out how we can eliminate the problem so that the symptom isn't occurring. And that's going to be the difference in how we address the early onset of our disease span. So looking at it from just a quick summary of what we've looked at in these initial concepts, imagine the difference of the financial impact of this area of the curve. So one way you can look at this is all this area in the curve, stick dollar signs in there, because those dollar signs are really what's happening. This is a significant, an early disease span is a significant cost burden on our healthcare system. If we can expand our health span as compared to our disease span, we're going to spend billions of dollars less in treating those symptoms. We can also look at the slope of the line. So is that slope dropping down quickly, or is it starting at 40 or 45 and then just limping along as we become more and more dysfunctional? So those are the things, those are a couple of things that we want to consider as we look at now, how can we do something that's a little bit more fun? And that is, what are we going to do about this stuff? What can we do to really address the issue? So, timeline. I encourage all of us to work with our patients, clients, and patients and clients on looking less at a health history and more at a timeline of their history. And the Institute for Functional Medicine is great. It's a great resource for looking at how to apply some of these ideas. But that first piece is, what are the things that were preceding events? So as you're sitting down with your client, what are the things that you need to get out of them that may have an impact on where they are today? I like to look at the current complaint side of my arrow and get an idea, why are they there today? What are they doing? What's their primary complaint? And then we can look back and look at family history, preceding events, gestational history. What were their parents' lifestyle choices? Did their parents have an early onset disease, but did they have poor lifestyle choices that led to that? The other piece, and the next piece, I should say, are what are some of the precipitating events, some of the mediators? What kind of childhood did they have? Were they on antibiotics multiple times as a child? What kind of delivery did they have? Were they a colicky baby? Where did they grow up? What environmental impact did they experience? And did they grow up with the standard American diet? If they grew up in the 60s and the 70s, I'm going to tell you what, there was a whole lot of ding-dongs getting eaten. So what type of diet did they, were they eating? And then lastly, what are the specific events that are leading to their current complaints? So what were the things that triggered their current complaints? And a great question to ask is, when was the last time you felt well? When was the last time you felt good? And look at what happened after. What triggered this demise in how you're feeling? So I promised that we were going to come back and chat a little bit with Bob, and so here's Bob's timeline. So both of his parents were smokers. Mom had a normal pregnancy, but father had an MI at 60, and his parents lived near an oil refinery. So just thinking about it from that perspective for a second, did his parents provide the chemical impetus to their chromosome to create a epigenetic change? So did his parents have an expression of their genes that led to his father's early onset of heart disease? So as a child, after he was born, multiple ear and throat infections, repeated courses of antibiotics. Who cares, right? It was when he was a child. The reason we care is what impact does that have on his microbiome, and was he ever able to reverse the impact on his microbiome that repeated courses of antibiotics may have had? And then at age 42 is when we started to see things begin to fall apart. Herniated disc. So his conservative treatment was cortisone injections and multiple doses of non-steroidal anti-inflammatories. Again, what impact does the NSAIDs have on microbiome? Tends to really disrupt normal bacterial growth. So at age 55, back pain got to the point where he couldn't manage it anymore, went in and had a lumbar fusion, poor outcome, minimal pain resolution. So at age 62 is when he came in to see me. Inability to sleep, had low back pain, decreased energy, decreased function, and I put kind of what his disease span curve looks like as the proverbial wheels were coming off the bus. So we had to take a step back, and when he came in with his wife, and they were sitting, and he was not thrilled. His wife really brought him in. He was not thrilled to be there. And I said, okay, you guys, look, we need to take a step back. We need to look at the bigger picture. So we need to look at the emotional piece, the spiritual piece, the mental piece, in addition to the physical piece. So I often have people that come in and their expectation is, I'm a physical therapist, I'm going to treat the physical piece. But if I haven't addressed the emotional, the spiritual, and the mental components, then our ability to have a positive outcome on the physical piece is greatly diminished. I had a great analogy the other day. I was sitting with a group of orthopedic surgeons, and the cervical spine orthopedic surgeon was talking about that he finally starts to see the impact and the relationship between how the shoulder functions with how the neck functions, and the shoulder surgeon finally said, God, thank God he finally started to look at that. He said, you know, as physicians, we are so good at looking at our leaf. We're so good. We know that leaf inside and out, upside down, backwards. We know that leaf better than anybody else. But oftentimes we forget the tree. And what I want us to look at is, by taking a step back, what are the roots doing in our tree? What are the branches doing in our tree? What's the trunk doing in our tree? What are all of the components that are leading to the leaf that might be dysfunctional? So if I have a dead leaf and I just go and cut the leaf off, have I done anything to change what's going on in the soil? If I have bad soil, I'm going to have more dead leaves. Let's fix what's going on in the soil. So that first piece of fixing Bob started with stress. And there are some great MedFit webinars on breathing and stress reduction. I start all of my patients on a simple breathing exercise. I get them to try to even identify where their diaphragm is. So I'll have them with one hand on their chest and one hand on their belly, and try to visualize the air going into their lower lung lobes of their lungs, and kind of the air going out their hips. And you will be amazed at the number of people that can't find their diaphragm. Now, it's important from my perspective as a physical therapist, is if I can't get the diaphragm to function, I am not going to get the transverse abdominis to function. If I can't get the transverse abdominis to function, I don't care how strong my quote unquote core is, I am lacking the motor control to initiate that balanced core. So breathing goes with stress. Oftentimes I have men who are challenged by the concept of meditation. So I tend to say, let's do some mindful breathing. I just want you to do 3 minutes a day. That's where we start. And we get a significant change in their level of perceived stress and their ability to manage their stress more effectively. I try to get an idea of their quality of their relationship. Now, I am not a psychologist. I don't pretend to be a psychologist, and I don't want to go down that road. But in today's world of our forced social isolation, the number of people that are coming in to see us, and I, as an essential business, we are still seeing some people coming in. The level of stress associated with a lack of relationships is huge. So look at this as a component of what you're trying to do to manage the clients that you're coming in through this bigger picture. So we talked about sleep, we talked about relaxation, and oftentimes you're going to find that people have a difficult time with going to sleep. And so I spend time with everybody on developing what we like to call sleep hygiene, and having a plan. And an important thing, important next to you all night, turn it off an hour. I usually tell people at least no phone, start to read what the process is. So we need 8 hours of sleep. So it might mean that you're going to start this process 10 hours before you need to wake up. And if you're needing an alarm to wake up, then you're not going to bed early enough. You should be waking up without that alarm. Now, exercise and movement. We, as movement professionals, this is our no-brainer. But I think what I want to stress here is the importance of as we expand, we know cardiovascular disease has a huge impact on inflammation and opportunities for managing our inflammation. But I think what's important is that we need to look at this more strength and balance exercises as we get older. As we get older, we start to lose lift and up and down stairs, and these are the things that are the most challenging in terms of losing function. So developing and maintaining the strength that allows you to maintain balance, that allows you to maintain function while you're getting the exercise, cardiovascular exercise in that maintains, is these, in my equally as in, say that exercises, I can't say that relationships are exercise, they are all equally as important. And so, and again, nutrition becomes a real foundation. Without, you can't exercise your way out, or eating habit. Joel Furman did on MedFit a couple of weeks ago to listen to look at in terms of whole foods and lots of color and kind of minimal animal. I want here though, and I talked about this early on, we're not all the same. And so some people respond better to a keto diet, and some people respond to a protein diet, and some people respond better to a diet. Figuring out what's best for you is what's the best ways to do that. And this is what I did with Bob, is we cleaned the sleep, and I told him, he came in and his wife, I said, look, I can't do anything until we have an environment that's going to be healthy, that's going to be full. And that was really the first step, was a eliminate diet. So what things were triggers for that level of And this was, I do a whole 30 program, and day 17, in with his wife. His wife was in tears, and she said, I can't thank you. And he's off all of his pounds, I think, at that. But the for her is that he was sleeping in bed, and he was sleeping, and they had developed an ability to reconnect. And he came in, and I continued to see him a couple on his exercise program. Week 6, I haven't been able to do this, and I felt fine in 8 minutes. So we kind of focused on the whole person with Bob, and we looked at the slate, looked at what we could to decrease his systemic action so that we had the pain in his back. So then exercise program became more effective. Think three-dimensionally. Think three-dimensionally with your exercise programs. Think three-dimensionally from a lifestyle perspective. Remember, we don't live in one plane. So when we're talking about picture, design your exercises around multiple movement patterns, complex, add balance, add challenges, so that we recruit as much as we can. And it really will give people the opportunity to have some exciting new opportunities. So with that, I want to thank everybody for the opportunity. Like us on Instagram and Facebook, and one of the things that we have now is remote personal training. I was a little skeptical. Not it's prizes I've very, very well. So Kevin, I'm going to turn it back over to you, and we'll go from there.
So again, thank you guys for being here today. And Jim, thank you very much for a great presentation. We really enjoyed it, and we hope you'll be back again sometime in the future.
Thank you, Kevin. I'm looking forward to it.